Welcome. This video is designed to help you better understand life after your heart transplant. Now that you've received your new heart, there are some important things to know about how to care for and keep it healthy. We'll cover key topics such as your immune system, medications, monitoring for rejection, maintaining a balance between protecting your heart and staying safe from infections, dietary considerations, and life once you go home. The goal is to help you feel more confident and informed as you move forward with your recovery. First, we will talk about your immune system. Our immune system keeps us safe from infection by attacking foreign objects. These foreign objects could be germs like bacteria, viruses, and fungus, or a transplanted organ. Rejection is when your immune system recognizes your new heart as foreign and attempts to eliminate it. This is normal. You will be on immunosuppression or anti-rejection medications for the rest of your life. Let's talk about rejection. It's a scary word, but what does it really mean? Now that you've received your new heart, you need to do everything possible to stay healthy and prevent rejection. While the risk of rejecting your new organ decreases as time goes on, it never goes away. At least one episode of acute rejection is common within the first year after transplant, but can also occur years later. You will have frequent monitoring for rejection throughout your first year with biopsies and lab tests. How do we monitor for rejection? We perform a heart biopsy where we take a small tissue sample from the heart and analyze it under a microscope. This helps us look for signs of rejection. The procedure will take place in the Samsky Cath Lab or the Marcus Tower Cath Lab.
Once the pathologist has analyzed your sample under the microscope, they will provide us with a grade. Here's a breakdown of the grades. 0R, no acute rejection. This is the best result. It means that no signs of rejection are present and the body is accepting the new heart well. 1R, mild or low-grade rejection. There is a small amount of inflammation in the heart tissue. This doesn't usually require treatment, but doctors will keep an eye on it. 2R, moderate or intermediate grade rejection. There is a moderate amount of inflammation and the body is starting to attack the new heart more aggressively. This is usually treated outpatient with steroids to further suppress your immune system. 3R, severe or high-grade rejection. While rare, this is the most serious level of rejection where the heart tissue shows extensive damage from the immune system's attack. We will bring you into the hospital for a big tune-up to prevent permanent damage to the heart. Heart transplant is a balancing act of managing the immune system. We must intentionally weaken the immune system to prevent rejection and promote acceptance of your new heart. Our team works carefully to find the right balance. We want to make sure your immune system is weak enough to protect the heart, but strong enough to fight off infections.
Now let's talk about your medications. Your medication regimen is going to look very different than what you were used to taking before your transplant. Medications are your best friend. Medications are meant to keep you healthy and safe. It is very important to take each medication as it is prescribed and never stop or adjust them without talking to your transplant team. Missing doses or changing the way you take your meds can increase the risk of rejection, which we want to avoid. First, we will talk about your immunosuppression medications. These medications suppress or trick your immune system and allow your body to accept your new heart. Let's go over the 3 anti-rejection medications you'll be taking. You may notice each medication has both a generic and brand name. The names of these medications are Tacrolimus, also known as Prograf, mycophenolic acid, also known as Myfortic, and prednisone. Tacrolimus is one of the main lifelong immunosuppressants you'll be on. Tacrolimus works by targeting specific parts of your immune system to prevent it from attacking your new heart. Common side effects of this medication is tremors, headache, kidney problems, and skin cancer. You'll take this medication twice a day, and it is very important you take it every 12 hours at the same time every day to keep a steady level in your body. You'll have regular blood tests to check these levels that must be drawn in the morning before you take your medications. The second lifelong medication is called mycophenolic acid, also known as Myfortic. This medication works in a slightly different way than Tacrolimus, targeting other parts of the immune system. Together, these medications provide stronger protection against rejection. You may experience some gastrointestinal side effects, but there are ways to manage them, and your care team will work with you if needed. Like Tacrolimus, Myfortic is taken twice a day, every 12 hours at the same time every day. Finally, prednisone is the third immunosuppressant you'll be on. It helps to control inflammation in your heart and provide extra immune suppression. While prednisone is very effective, it can cause side effects, including high blood sugar, weight gain, mood swings, anxiety, stomach irritation, infection, and inability to sleep. You'll likely be on a higher dose right after transplant, but over time, your doctor will decrease it down to the lowest effective dose. Now we will discuss medications that will protect you from infections. These medications are meant to keep you safe from infection since your immune system is now weak. You will be on an antibiotic such as Bactrim or Mepron for 1 year to protect you from bacteria. You will be on an antiviral such as Valcyte or Valtrex for 3 to 6 months to protect you from viruses. Lastly, you will be on an antifungal such as voriconazole or nystatin for 3 months to protect you from fungi. In addition to your immunosuppressants and infection prevention medications, you may also be prescribed other medications to help you manage your overall health after your transplant. These could include blood pressure medications, cholesterol-lowering medications such as statins, and supplements. Before starting any new medications, whether it's something prescribed by another doctor, an over-the-counter medication, or supplements, always contact your transplant coordinator first. Your coordinator can tell you if it's safe or if it might cause problems with your current medications. You should refer to the list of safe and unsafe medications that we've provided you. It is important to avoid any medications containing ibuprofen, such as Advil or Motrin. Instead, acetaminophen, like Tylenol, is usually a safer option for pain.
We will provide you with a printed medication list called a Med Action Plan to help you fill your pill box. Always refer to this list, not the instructions on your pill bottles, as medications can change frequently. One of the most important parts of managing your health after a heart transplant is making sure you never run out of your medications. These medications are crucial to keeping your new heart healthy, so it's vital to always have them on hand. If you notice that any of your medication bottles have less than 7 days of medication left, please contact your pharmacy right away and request a refill. It's better to plan ahead so you don't risk missing a dose. Running out of your medications, even just for a short time, can increase your risk of rejection or other complications. We also recommend that you buy all of your medications from the same pharmacy. This way, the pharmacy can keep an accurate record of everything you're taking. For at least the first year after your transplant, we recommend using our specialized transplant pharmacy. They work closely with our team to monitor your medication profile and ensure everything is correct and up to date. Their experience with transplant patients makes them a valuable resource in helping you stay on track with your medications. If any medicine is soft, sticky, hard, or cracked, or has a notably different color or odor, ask your pharmacist to replace it with a new prescription. Always swallow capsules whole and never take them crushed, chewed, or opened unless otherwise instructed by your transplant team. Keep your medications out of the sun and extreme heat. To protect your medications, always store them in a cool, dry place. For example, it's best to avoid keeping them in places like your car or by a window where the temperature can get very high. Extreme heat can break down the medication, making it less effective, and that would put your health at risk. Instead, find a spot in your home like a cabinet or a drawer where the temperature stays consistent and your medications are protected from moisture. Establishing a routine with your medications and daily care is one of the best things you can do to protect your new heart and stay healthy. Consistency is key to making sure your medications work properly and you avoid potential issues. One helpful way to stay organized is by filling your pill box once a week. This makes it easier to keep track of your medications and ensures you never miss a dose. If you need help setting up your pill box, we are happy to assist you with that during your clinic visits. It's also important to take your medications at the same time every day. This helps keep the right levels of medication in your body, which is essential for preventing rejection and managing side effects. Set an alarm or reminder if it helps, but make it part of your daily routine. Another part of your routine should be taking your vital signs, like blood pressure, heart rate, temperature, and weight, and recording them before you take your morning medications. This allows you and your transplant team to track your progress and catch any potential issues early. It is up to you if you want to eat or not with your medications, but please do the same thing every time. This will help an even absorption and hopefully lower your side effects. Communication is key to your success after transplant. Remember, we are always available to help you with your medications. If you forget or are unable to take your medication, call your coordinator. The goal of your transplant team is to help your body accept your new heart and lower the risk of side effects. Your transplant team will work with you to find the treatment plan that's best for you. Now, let's talk about preventing infection and dietary considerations. The number one way to protect yourself from infections is proper hand washing. You should always wash your hands before cooking or preparing food, before eating, and after using the restroom. At home, make sure you have enough antibacterial soap, such as dial soap, next to your sinks to help ensure effective hand washing. When you're out and about, it's important to carry alcohol-based hand sanitizer with you. This way, you can keep your hands clean even when soap and water aren't available. For at least the first 6 months after your transplant, it's important to wear a mask in public spaces, especially in crowded areas or places where you might be exposed to illness. Avoid people who are sick. Do not share food or eating utensils with others, as this can easily spread bacteria and viruses. There are certain activities and environments you should avoid to reduce your risk of infection, such as tattoos and piercings, pedicures and tools on your cuticles, walking barefoot, especially outdoors. Cuts and scrapes on your feet can easily become infected. Stay away from stagnant water and damp environments, such as hot tubs, hot springs, and any dark, damp places, such as basements, caves, and rivers. These environments can harbor harmful bacteria and fungi. While it's best to avoid certain bodies of water, pools and streams can be safe when deemed appropriate by your surgeon. One important aspect of infection prevention is how you interact with your pets, especially when it comes to handling pet waste. To protect yourself, do not handle pet waste unless absolutely necessary. Pet waste can carry harmful bacteria and parasites that could lead to infections. If you must handle pet waste, be sure to wear both a mask and gloves to protect yourself from germs and avoid direct contact. For best protection, it's advisable to have someone else in your household take care of cleaning up after your pets. There are specific activities like gardening and exposure to dust that can pose a higher risk of infection, especially earlier in your recovery. Avoid gardening for the first 6 months. Soil can contain harmful bacteria and parasites that can lead to infections. After 6 months, you may begin gardening again. However, it is crucial to always wear gloves and a mask to protect yourself from harmful bacteria that might be in the soil. Stay away from construction zones, home renovations, or any place with dust in the air. Dust can carry mold, bacteria, and other particles that can be dangerous to someone with a suppressed immune system. It's important to be mindful of what you eat, as certain foods can affect the way your body processes your medications. Here are some key foods and products you should avoid. Grapefruit and grapefruit juice. Grapefruit can interfere with how your medications are absorbed, which can make them less effective or increase the risk of side effects. Be sure to check labels carefully, as many juice drinks contain grapefruit. Avoid using St. John's wort and other herbal products. These can interact with your medications, affecting their effectiveness and potentially causing harmful side effects. Maintaining proper food safety is essential to protecting your health and preventing infections. One of the most important steps in food safety is making sure your food is cooked to the correct internal cooking temperature. Please refer to this diagram for the minimum internal temperatures and rest times for certain foods you may cook at home. It's essential to take extra precautions when handling and preparing food to reduce your risk of infection. Here are a few important food safety tips to keep in mind. Wash all fruits and vegetables. This helps remove dirt, bacteria, and pesticide residues. Peel fresh fruits and vegetables when possible. Cook all meat and eggs thoroughly. Eating undercooked or raw meat and eggs can increase the risk of foodborne illness, which is especially dangerous for someone with a suppressed immune system. Certain foods can carry a higher risk of harmful bacteria, so here are the foods you should avoid. Tap water and well water, as they can contain harmful bacteria and parasites that could lead to infections. You should stick to bottled water. Avoid deli meats unless they are heated to steaming hot, as they can harbor harmful bacteria like Listeria. Stay away from uncooked cookie dough, runny eggs, smoked fish, sushi, and raw sprouts. These foods may contain harmful bacteria that can cause foodborne illnesses. Avoid unpasteurized juices and ciders. Steer clear of buffets and potluck gatherings where food can sit out for long periods, increasing the risk of contamination. Avoid pre-cut fruits and vegetables. It is best to cut fruits and vegetables yourself. Avoid miso, as it can contain harmful microorganisms. It is important to keep food preparation areas clean. To prevent cross-contamination, use separate cutting boards, utensils, and plates for raw meat and raw produce. This helps to keep harmful bacteria from raw meat away from your fruits and vegetables. Always thaw meat in the refrigerator. This prevents bacteria from growing on the surface while the inside is still frozen. Avoid thawing meat at room temperature. Remember to always follow the 2-hour rule. Keep hot foods hot and cold foods cold. Foods should not sit out for longer than 2 hours. To ensure food safety, any leftovers should be discarded after 24 hours. Even if they look fine, harmful bacteria can still grow in leftover food. It is important to make smart food choices as you recover from your transplant. Choose foods low in fat and salt. A few of your transplant medications can raise your blood sugar, which is why it's important to avoid high sugar foods and drinks right now. Examples of high sugar foods and drinks are pasta, dessert foods, white breads, juices, and sodas. Eating 3 well-balanced meals is important. Be sure to select foods high in whole grain, fiber, and protein. It is important to drink plenty of water. We recommend drinking at least 2 liters or 64 ounces of water a day. Once again, avoid juices, teas, and sodas as your body needs good hydration at this time. It is also important to continue receiving vaccines after transplant. However, we recommend no vaccines for the first 3 months after transplant. Vaccines such as the flu shot, tetanus, hepatitis, and pneumonia vaccines are safe to receive. We recommend that all caregivers and patients receive a flu shot every season to decrease the chances of illness. You should always avoid live virus vaccines. Examples of live virus vaccines include many childhood vaccines, such as measles, mumps, and rubella. Be sure to check with your provider before receiving a vaccine to make sure it is not a live virus vaccine. Also, if you are around an individual who has received a live virus vaccine, it is our recommendation that you avoid that person for 10 to 14 days to avoid transmission. Life after transplant. This is a very exciting time for you, and it's important to take good care of your new heart. Let's discuss how. This is our number one question. Yes, you can shower when you get home, but you must pay careful attention to your incision. Avoid placing the shower head directly onto your incision. Instead, keep the shower head on your back. Let the water run over your incision with soap. Cleanse around the incision with your hands and then towel dry off afterward. There is no need to place any lotions, creams, or powders on your incision. You will need to monitor your incision to assess for any signs of infection, such as redness, heat, and drainage. Contact your transplant coordinator should you notice any of these signs. Now let's discuss skincare. A few of your transplant medications will make your skin more sensitive to the sun, causing you to be at a greater risk for skin cancer. To prevent this, please wear SPF 30 or greater sunscreen when you're outside. We will provide you with a bottle of this at discharge. It is recommended to follow up with your local dermatologist of your choosing yearly. Please let your team know if you see any new moles or skin discoloration. It is important to listen to your body and be active as you recover. Choose activities that feel right for you. Frequent short walks are a great place to start. This will keep your blood pressure down, your heart healthy, and help mitigate any fluid weight gain from surgery. Once your incision and sternum has healed, we will refer you to cardiac rehab at your local Piedmont hospital. This program will strengthen you over the next 8 to 12 weeks and typically consists of 3 sessions a week. While you may be excited to travel with your new heart, taking trips is not recommended just yet. The transplant team recommends patients to stay close to home for the first 6 months of transplant. This is when your immune system is at its lowest, as it adjusts to your new heart. When you have been cleared to travel, be sure to always take extra doses of your medications to ensure you have enough for your trip. Remember, never check medications in a packed bag on your flight. Always carry medications with you. It is important to monitor your health at home. We will provide vital signs logs at discharge so that you can document your blood pressure, heart rate, temperature, and weight. Contact your coordinator if you notice any of the following: high or low blood pressure, such as the top number consistently reading above 150 or below 100. Fever, this could be a sign of an infection. Or weight gain of greater than 3 pounds in one day. Please save our phone number and notify your coordinator if you experience any of the following: symptoms of illness such as fever, vomiting, or diarrhea, any change in insurance, address, or phone number, any admission to a hospital other than Piedmont, Atlanta. Remember, if you are needing to be admitted to a hospital, it should only be at Piedmont, Atlanta, because this is where your transplant team is. Notify us of any planned procedures, surgeries, or dental appointments. Now let's prepare for your first clinic visit. Going forward, it is important to not take any medications prior to your labs being drawn. Please bring all medications with you so that you may take your pills after your labs are drawn. Please bring your pill box, pill bottles, and med action plan so that we can continue to help you refill your pill box until you are confident. All of your transplant follow-up will be at Piedmont Atlanta Hospital. Your coordinator will schedule your follow-up appointments, but please keep an eye on my chart to monitor for any new appointments. You will also be called the day before your appointment to remind you of the time. If you need to modify your appointment in any way, please call our scheduler at 404-605-2419. Emergencies can happen after transplant. Remember, if you're experiencing an emergency such as severe chest pain, difficulty breathing, sudden onset of confusion such as stroke-like symptoms, call 911 before calling your coordinator. Please see this slide for our contact information. You may contact our team 24/7 at 404-605-3040. During business hours, Monday through Friday, 8 a.m. to 5 p.m., you will be connected to a coordinator. After business hours, you will be directed to the on-call service to discuss your urgent matter. They will direct you to an emergency room if necessary.